Hi, I'm Mark Needham. I am the Programme Director for the Digital First programme in Kent and Medway, which is part of the Kent and Medway health and care system. The project is called Digital Care Homes in Kent and Medway. We were very distressed in March last year with the first peak of COVID and the impact that had on care homes. We felt we'd let them down. Care homes are self-isolated. They had to self-isolate to protect residents and they've become cut off. This made it practically impossible to provide primary care to care homes. We won £500,000 of funding from NHSX and our aim was to build a digital bridge to care homes with primary care. Our experience of running the project over the past 6 months has been to tackle three main problems. The first problem was there's been very limited IT in many of the homes. It's not uncommon to have one computer for the whole care home or staff to be using their phones. We won funding for iPads and we provided 509 iPads in those homes, which are used every day. The second problem we experienced was around digital literacy and the variation in people's knowledge and awareness of technology and how to use it, including simple things like registering for NHS mail. It's very difficult to communicate with people, to build a bridge when you can't communicate with people on the other side. And we've delivered 415 training sessions in 323 care homes within 6 months. The third main problem we found, and the most important really, was the social isolation of residents in care homes who were having to self-isolate. And we've worked with our adult social care council partners to deliver devices called Cara, which allows families to communicate with their loved ones. Fortunate to have been selected to be a digital pioneer. The course provides everything that I thought it would, really good insights, learning, access to people who have done similar projects. The real benefit for me has been the ability to work with a peer group. It's made me feel less alone when dealing with big problems. It's given me inspiration and support, and it's also allowed me to develop my knowledge of digital transformation and how to provide digital health and care services. The level of success we've had has really been unexpected and unprecedented. Last March, we were only sending a small number of online consultations, including with care homes. We're now sending 55,000 consultations a month, as well as 2 million text messages. We've been really successful in supporting over 300 homes. We've supported 1,000 patients with pulse oximetry, which has helped save lives. And we're now this year looking at supporting 6,000 residents in care homes and in the community as well. And we really couldn't have expected to achieve those results and make such a positive impact to people's lives. The main advice I would share with other programs is that the problem is often bigger than just you. By working with health and care together, we've been able to overcome some really big and challenging problems. We've also provided some blueprints for other areas that they can learn how to do this themselves. And I think the Pioneer programme has really helped me share my learning and also learn from others, which has contributed to the outcomes of the project.